You want to hear me? Okay, there. So this morning we're gonna do two treatments using the ALMA Q laser. First, we're gonna do the carbon peel. So the carbon laser peel is actually a very popular treatment in the Philippines. It's also known by a lot of names as a China doll peel, the porcelain peel. So what it does is it shrinks the pores, it reduces oil production in the skin. So you will see now, Islet is applying the carbon photo enhancer. It comes in a cream type, so we actually need a few minutes for it to dry up. So she's applying it all over the face. What's good about this treatment is that it's safe for all skin types. There's no pain, there's no downtime. The patient can actually go home after and maybe have some slight erythema on her face. So we apply it all over the face, including the forehead and the cheeks. So, but you actually need 10 to 15 minutes to wait for the carbon to dry. So while we're waiting for that, let me do the other demonstration, which is also very popular in the Philippines, which is a treatment for axillary hyperpigmentation. I actually do two treatment protocols, one using the focused handpiece, which delivers a full beam of the Q-switch and diag. This is a little painful, which sort of will feel like an oil splatter. The patient's underarm has been cleaned, so the parameter for this treatment is, can you focus on the this one? So Q-switch and diag using the focused handpiece. What's good about this machine is that it allows you to deliver double pulse or the double pulse mode, which allows you to deliver high energy split into two different pulses for patient comfort. My usual setting is somewhere between 2.2 to 2.6, so I'm going to use 2.4. The speed will depend on your skill. You can choose 5 or 10, but I prefer to do 10. So for this treatment, I use the 7mm handpiece. So it's very simple. I usually do 4 to 6 passes. So it's just a sliding motion. Make sure that your handpiece is about 2 to 3 millimeters away from the treatment area. Are you okay? So the patient can feel a slight tingling, similar to an oil splatter, but nothing more than that. I prefer to use a larger spot size because usually when you use a smaller spot size, it causes some petechiae. So what's also good about using the focused handpiece is that most of my patients notice thinning of their hair or delayed hair growth when I use the focused handpiece. Improvement. So now I'm going to show you another option that I use for patients with low pain tolerance because some patients, especially in the Philippines, they don't like to feel pain at all. So what's good about this machine is that it comes with a fractionated handpiece, which delivers a fractionated beam of the Q-switch and diag. So it also comes in, it actually delivers the energy in different levels. So this is how the fractionated, can you focus? Yeah. So yeah, Ayelet will do a demo. Wait, let me. So you see it's much shallower. Now we go to the 0. So for treating post-inflammatory hyperpigmentation, I like to use -1 and 0. And now we go to +1. I also like to use this modality for melasma because as you know, we sort of shy away from using high energy and high fluence in patients with melasma because inflammation is another one of the triggers. So this is the +2. So I like to use +1 and +2 in patients with a lot of pigmentation, epidermal pigmentation, who do not want the downtime associated with using the 532.
That's a
So
wonderful demonstration.
yeah, so the protocol is similar. So I usually start with -1. And instead of counting how many passes, I actually base it on accumulated energy, which there's a counter here in the screen. So for the underarm, I tend to use 1,500 for the entire area. So for the carbon peeling treatment, I actually like to use two wavelengths. And I like to use the collimated handpiece, which is fixed at 8 millimeter, just because I don't like the splattering of the carbon into the lengths of my handpiece. With the collimated handpiece, as I'm sure you already know, you can actually be quite far from the target area or the face. So the quasi-long pulse laser is more of a heating, so it doesn't really have a photoacoustic or mechanical effect. So the purpose of the quasi-long pulse is to heat the carbon, to help it dry up also, and to heat the dermis. So with the help of the carbon, it actually enhances the effect of the heating. So we go to quasi-long pulse, collimated. I like to use the lowest setting, which is 1 joule, because if you go higher, it's a lot painful and the patient might have urticaria after. So it's very important to have a smoke evacuator. So I'm going to start now. Usually I do 1 pass of this. The patient might feel some heat, but it's not really pain. Okay. Sorry. Are you okay? So now we have to change to the Q-switch NDAG laser handpiece to remove the carbon. So with the Q-switch NDAG handpiece, you can actually use the lowest energy of 0.5, or you can use 0.8 or 1. I don't usually go that high because you don't need that much energy to actually explode the carbon. So we're gonna start. So you have to warn your patient about the sound. Some of my patients get anxious about the sound. How are you feeling? She's not saying anything. So I usually recommend doing the carbon peel laser treatment on patients with oily and acne-prone skin, but I don't do it on patients with active acne. In the Philippines, having big pores and oily skin is a big major concern, especially in the younger population. Some of my patients even actually ask to do this in selected or certain parts of the face, such as the nose and the cheeks. I also noticed that when you do this treatment on patients with dry skin, it tends to make their skin drier, so it's not advisable to do it on dry skin. For patients with oily skin, they usually notice a decrease in oil production as early as 2 days up to 2 weeks after the treatment. And the protocol for this treatment, I usually do it every 2 to 4 weeks for about 4 to 6 sessions. And then they can maintain on it once every 3 to 6 months. So more recently, I've actually started using this in the treatment of seborrhea in patients who don't like to take a low dose of oral isotretinoin or don't like to apply creams, mattifying creams and such.
Is there
Well,
any difference with the use of the carbon peel or not, or is it just for effect?
well,
Is the question.
actually, okay, a lot of studies show that the use of quasi-long pulse alone and the use of Q-switch and Diag lasers alone actually give improvement. But more recent studies have been published that the use of carbon photo enhancer actually magnifies the results. So because this uses low fluence, low energy, it's actually more comfortable to the patient. It causes less pain, while the efficacy of the Q-switch and the quasi-long pulse with the carbon is enhanced. So a study was published, I think, in 2017, comparing the use of quasi-long pulse with carbon and without, and the Q-switch NDIAG with and without carbon, and the efficacy of the lasers actually increased by about 30 to 40%.
Thank you again, Irene, for a wonderful demonstration and very effective on cameras.